Hey friends, hope you're doing well. Welcome to another video. Now this is a video that I've been thinking of doing for a little while. I had been asked a number of times to do a video on this, and the title is 5 Ways to Faster Recovery After Your Gastric Sleeve Surgery. Now let me, for the sake of simplicity, we could talk about lots of hypothetical sort of scenarios. What if I've got a lot of pain or infection or redness of the wound? But I wanted to just keep it very simple to how you can expedite your recovery while you're in hospital after surgery. Now, most of the times people after a gastric sleeve surgery, and if their course is relatively expected, not going through any major issues, they would expect to stay anywhere between 2 to 3, 4 days thereabouts in the hospital. Understand that this can be a very overwhelming phase in people's lives because, recovering from anesthesia, going through issues around pain, it can be very emotionally traumatic to some people. Of course, besides the physical pain, different people react differently to pain. So all of those things are, sort of factored in. But there are 5 strategies that I have come to sort of practice and, preach, I should say, and talk to people about that I have found to be particularly beneficial in kind of helping recover faster, but also connect with what your body is telling you. So the 5 strategies are as follows. The first strategy is prepare yourself mentally. You would have heard of many people say, including people like Tony Robbins, that any work that you do, 80% of it is your psychology and 20% is the physical effort that you put into it. So prepare yourself mentally prior to actually going through the surgery. What I say is that calm yourself, anticipate what you are visualizing, what is it that you are expecting out of this. If there is pain, that's fine. There are mechanisms to manage that, and we'll cover that in a moment. But the point is that prepare yourself mentally. That's the key thing. The second aspect is that of get adequate pain relief. Now, most of the patients after the surgery of gastric sleeve would be given what we call as a PCA, which is like a button. You get that and you press the button and the system or the pump automatically injects a painkiller medication into your system, and you cannot overdose yourself. Even if you were kind of repeatedly pressing this button, there is a rider, there is a governor on that, which is determined by our anesthetist, who decides what is the safe dose for you to have from analgesia point of view. But having good pain relief allows you to basically do 2 key things. It allows you to help your lung function improve, and that's the key thing where pain relief is key and is crucial. More importantly, it allows you to do the other steps that I'm just going to be talking about, such as ambulating and walking and all of that. Mind you, we've got some very good, very safe drugs now that are available, which have got a very safe side effect profile. So pain relief is much better than what it used to be, say, 2 or 3 decades ago. Third strategy is that of walking. Now, walking is amazing, and our physiotherapists, after your surgery, once you've had your, after the 24 hours after surgery, our physiotherapists will meet you. They will explain to you what the purpose behind walking is, and gentle walking, and what it allows is it has got significant advantages. It reduces your risk of developing DVT, deep vein thrombosis, or clots in the legs, which can travel up to your lungs and create issues. It improves your lung function, and very importantly, it reduces that bloaty sensation that people get in the tummy after gastric sleeve surgery, because as you know, we do all these operations using keyhole surgery. So those are the advantages of walking, and the sooner you start walking, the better it is for you in terms of recovery. Fourth strategy is that of taking more fluids. Now, understanding that gastric sleeve surgery removes 60 to 70% of your stomach, so your new tummy is like a baby's tummy. You've got to take small, frequent fluid intake. because initially for the first 2 weeks you are going to be what we call as a bariatric free fluid diet, and that is things like tea, coffee, soups, even your Optifast shakes and broths. And that's what we encourage you to take on a consistent basis. And here I've got one strategy which can really be a helpful tool for you to remember, and that is your smartphone. The smartphone has got the function of putting a timer. Put a timer in your phone for every hour. So every hour the timer rings, and what it is it's a reminder for you to have some fluid to drink, go for a walk, come back and rest on the chair. I ask people not to get on the bed from the time between sunrise to sunset, because what that does is it keeps you active. It keeps you walking around. Even if you're sitting on a chair reading a book, no problems with that. And then the timer rings and you're ready for your next routine. And this allows you to take up to at least a liter a day, which is your target after surgery. If you are able to take a liter a day in small frequent sips all through the day, I can tell you, you will surprise yourself with the speed with which you will recover. The last and the final strategy of recovering faster from your gastric sleeve surgery is to manage your stress. As I acknowledged early on, that sometimes anxiety around surgery, what could be the outcomes, the risk of complications and things like that can cause a lot of anxiety to build up, which affects your ability to get adequate pain relief. So things like deep breathing exercises, when you're sitting in the chair, just closing your eyes and just focusing on your breath, listening to some music, nice calming soothing music, or reading something light, not very heavy, and all of that could be a great way to actually manage your stress. One other way which I have personally found to be very effective is listening to a guided meditation, which helps you get aware of your body, what your body is experiencing, the sensations and all of that, and allows you to calm yourself and be in the moment. And that's a great way of managing your stress. And if you're looking for a guided meditation, you can jump onto our website www.centerforweightloss.com.au, and in the support section there is a free guided meditation for pre-procedure. This is something that we mail out to all our patients anyways, but if you're looking for something, there is an option over there which we have created specifically for patients who are undergoing surgery, and they are going through that emotions which are building up to the day of surgery. So this is another great way of managing your stress. So I hope you found this video of some use. If you did, please share it with anyone who you think who might benefit. Good luck with your surgery, and try and implement these 5 strategies, and I can tell you, you will be pleasantly surprised. Good luck and take care.